Good afternoon, everyone, and welcome. My name is Anna Rowinska, and I am your technical host today. Thank you for joining us for our town hall on mental health at work. If you're having any troubles hearing, please click on the bottom left where you see the microphone. Click on the up arrow where you can select various audio controls. Although your microphone is not enabled today, you can ask questions at any time through the Q&A icon. Thank you to those of you who pre-submitted your questions as well. Please use the comments section to chat with other attendees, share your thoughts, and let us know where you are from. We will invite our panel to respond to as many questions as we can during today's session. Our moderator today is Lisa McGuire, founder and CEO of the Manufacturing Safety Alliance of BC. Welcome, Lisa.
Thank you, Anna, and thank you everyone for joining in today. Before I begin, I'd like to acknowledge that I'm speaking to you on the unceded territories of the Stolo people, part of the Coast Salish region of southwestern British Columbia. For those who do not know us, the Manufacturing Safety Alliance of BC is the not-for-profit health and safety association serving manufacturers and food processors. We're here to answer your health and safety questions to help keep your workers safe. Take a moment to visit our website as we have a number of safety training courses and resources available, on-site or virtual engagements to provide specific needs to assist you, together with information on how to develop an occupational health and safety management system to the Occupational Safety Standard of Excellence, core certification for manufacturing. The events of the past 2 years have had a significant impact on our mental health and the mental wellness of our teams, from the pandemic to climate change related disasters, with now the war in the Ukraine has only added to the mental burden we have endured. We're here today to discuss the role of workplace mental health and wellness in our overall health and safety programs. In this time of mental overload, where do we even start to address the need in our organizations? And how do we do it on top of everything else we're facing? We're hosting this town hall at the launch of a new mental health strategy for the manufacturing sector, developed in collaboration with a steering committee of mental health experts and industry, labor, associations, and government partners. A 3-year action plan has us providing awareness on mental health through delivery mechanisms such as webinars, with 3 planned for this year, and a dedicated mental health resource library launching later this year. Developing a tool for screening and selecting existing mental health resources that meet manufacturing sector needs, and together consulting with you, industry, through focus groups on the effectiveness of these resources and products, and identifying any development gaps developed next year and the subsequent year following. Developing a mental health strategy for industry using an integrated approach, including the creation of an occupational health and safety management system standard that includes psychological safety. And of course, adding a new specialist to our staff to support your workplace mental health programs. In the follow-up of today's session, we will share the strategy and action plan along with a collection of resources you can use as a starting point in shaping a path forward for your organization. A more comprehensive resourceful library will be built after the tool for assessing industry-aligned resources that is scheduled to be completed in June. But now it is my pleasure to introduce our expert panel here today, our Honourable Sheila Malcolmson, Minister of Mental Health and Addiction, Dr. Ashley Spetch, Chief Mental Health Officer at WorkSafe BC, and Jonathan Morris, CEO of the Canadian Mental Health Association. By way of introduction, can I ask each of you to share a brief high-level introduction to your strategy to address mental health? Starting with you, Minister. I know that there is a government strategy, the Pathway to Hope. Can you please share your perspective on that strategy and what you hope to achieve over the next 3 years?
Thank you so much. I'm really honored to be joining you all. I'm joining you from Nanaimo First Nations territory in Nanaimo, and it's such an important conversation that we're having here. My friend and predecessor, Judy Darcy, who was the first Minister of Mental Health and Addictions anywhere in Canada, talked probably with many of you and your partners, built together what we call Pathway to Hope, and it was launched in 2019. It's a multi-year plan. Recognizing when we came into government in 2017, there was not a seamless integrated system of mental health and addictions care. You know, we want people to be able to approach if they have a psychic injury or substance use a challenge. We want them to be able to approach the healthcare system, be met with care, but be met the same as if they had a injured arm or a heart disease. And we aren't there yet, but this is our plan to build there. Initially, our first 3 years of the action plan were really focused on priority areas, supporting wellness for children, youth, and young adults more than anything, really recognizing that if we intervene early, while problems are still small ones, we may be able to set people up for success in the very long term. Also, a real focus on supporting Indigenous-led solutions, which we continue to do through First Nations Health Authority, saving lives through better substance use care, which of course has been such a terrible challenge when the pandemic, COVID pandemic, exacerbated in many ways and made the overdose crisis worse. Notwithstanding, almost every week we've been making new announcements on new community counseling, opening hundreds of new addiction treatment beds, intervening in areas of real innovation like prescribed safe supply, and working with partners in many places. And we'll talk about this, I think, more over the hour about how we can work with industry and business leaders around supporting workplace mental health. And then maybe just a final example that I'll give is really recognizing that shame and stigma often prevents people from reaching out for help. Lots of social media, television, partnership campaigns to be able to normalize conversations like this, to say that it's okay not to be okay, to open up those conversations about mental health and wellness. And particularly as it relates to substance use, because drugs are so much more toxic, because the coroner has found the majority of people dying or dying alone, often their family and friends had no idea that they were struggling with a substance use problem. And so as a major way to combat that stigma, we're applying to the federal government to decriminalize people who use illicit street drugs, to more firmly assert that substance use and addiction is a healthcare problem, not a criminal justice problem. That application is well underway, and another example of the work we have going on right now that we hope will pay off for people's mental health in the long term.
Thank you, Minister, and all, excellent work. We looked at the pathway to hope in shaping our own strategy. So thank you for that a remarkable introduction. Jonny, can you tell us about CMHA's strategy around supporting mental health in the workplace?
Yes, well, thanks, Lisa, and I'm honored to be joining you today from unceded and ancestral Tsleil-Waututh, Musqueam, and Squamish territories, and a big honor to be on the panel alongside Minister Malcolmson and Dr. Spetch today. I'll just share some brief comments around our own strategy, and part of this is how we are doing work internal to our organization at BC Division here, the Canadian Mental Health Association. And it's also informing work that the Ministry of Mental Health and Addictions have asked us to do with a number of aligned target sectors across the province. So I think you've said this, Lisa, when I've spent time with you before, we do need strategies to measure, because arguably what gets measured ultimately, hopefully, gets managed. And so it's one thing that I'm particularly proud of here at the Canadian Mental Health Association is our leveraging of a tool called Guarding Minds. And I scrolled through the attendee list. I actually think some folks who were involved with that are actually on this call. Guarding Minds is a made in BC survey. It was made by researchers a number of years ago, and it aligns so strongly with what's known as the 13 factors that underpin a psychologically safe workplace. Everything from workload to clarity of leadership expectations. And we've run that survey for almost a decade in our organization, and it's allowed us to see where we have hotspots in and around psychological health and safety amongst our staff group at the divisional office. And it's also allowed us to work in partnership with staff, including the Joint Occupational Health and Safety Committee, to prioritize actions for change within our organization. So it might be education, it might be training, it might be developing new policy around bullying and harassment reporting, or good dialogue around workload management, which is always tough in a non-profit environment, but so critical for balance, particularly given how our world of work has been turned upside down for almost 2 years. And for us, at least, we're still kind of in this remote space. So Guarding Minds has been so key, and we've used that to leverage action against the national standard for psychological health and safety to gradually and incrementally make change, systemic change, not only telling employees, here's the helpline or take care of it yourself. We recognize that that's not enough. Really looking through the structural and systemic policy required from my office, the board, across the organization to make change. And I'll comment on this a bit later, but that frame, and we've been at this for some time in Canada, has really informed the work that we're doing with a very large investment we received from the Ministry of Mental Health and Addictions 18 months ago to do focused work within the continuing care sector, the tourism and hospitality sector, and the community social services sector. And so that thinking of measuring education and training around mental health, helping managers have conversations, challenging conversations if they're worried about someone, and supporting C-suite VP executives to leverage the tone and the culture change that's required, all whilst adhering to WorkSafe's regulatory apparatus, has very much informed the development of BC's Workplace Mental Health Hub that we've recently launched on behalf of the province in partnership with health and safety associations, much like yours, Lisa. So we try to be as strategic and thoughtful in our approach, and it can be a stumble at times, particularly given the complexity of the environment we're in, but very happy to share more later. But I'll pause there, Lisa.
Thank you, Jonny, and really excellent points. The partnership's important. We're all in this together, right? Looking at how do we help and enable others to be successful with tools, as you mentioned, Guarding Minds at Work. How do we help industry identify those areas of action, which are probably more familiar from a physical perspective, but a psychological one, not so much. So really excellent pieces. And again, at the end of this webinar, we'll have resources and tools that will accompany this webinar package. Ashley, welcome. Can you share some insight into the WorkSafe BC strategy here today?
Absolutely. Hello, thank you so much for having me today. And I'm pleased to join from the Musqueam, Squamish, and Tsleil-Waututh nations as well. So We're a little bit different in that we kind of have three major sections to our mental health strategy, and we are currently working on developing an enterprise-wide strategy which will incorporate all three areas. So we have the occupational health and safety, sort of the prevention supporting other employers across BC side. We have the claims and rehabilitation side, and that is where my role falls, supporting injured workers with their recovery and safe and durable return to work. And then we are also an employer ourselves. And so we have our own employee health and well-being component of the mental health strategy too. So within the prevention side, it's really a focus right now on education for employers. There's been a lot of work done with first responders and now moving more into other sectors. So that's some exciting work going on there. In terms of the claims and rehabilitation side, one of the focuses that we have always had is on providing timely access to empirically supported treatment. We have had challenges with this, and this is something that I imagine will come up, is that there is a lot of need for mental health support, and so there is a strain on the resources. And so that is a big focus for us, is trying to keep up with the increasing demand of psychological injury that we're seeing happening in BC, and making sure that we have the most innovative programs that we can to support people in their recovery and early but safe return to work. And then as an employer, we're really focusing on building resilience, ensuring we're doing the appropriate selections, that people are in jobs that are a good fit for their psychological health, and then the education piece. So we're leading a 1.5-year long seminar called Mental Health Conversations, where we're getting a wide range of diverse speakers from all over North America, potentially internationally as well, to work on just increasing comfort and having that conversation about mental health.
Excellent, Ashley. Lots of work being done, and thank you for that
Yes.
introduction. Really looking forward to continued partnerships. Again, really actually WorkSafe BC also we're part of the steering committee that developed our strategy. So thank you. Minister Malcolmson, how does the budget 2022 that was just released continue the work underway by your ministry to support workplace mental health? And what are some of the services of programs that employers should be aware of?
Yeah, it's really it's an unprecedented time. You know, the need is so deep, the need is growing. Conversations like this lift the taboo from people reaching out and asking for help, and that is a really good thing. It means that it's incumbent on us to make sure that people are met with care when they take that really brave step to come forward. With this year's budget, we're now investing $2.8 billion every year to transform mental health and substance use care in British Columbia. The continued investment in responding to the toxic drug crisis invests $430 million through budget 2022 over the next 3 years. Last year's budget was a 3-year investment, $500 million, and a one-time, the single largest injection of resources into a healthcare system that admittedly fighting 2 public health emergencies and just having rolled out unprecedented mass immunization campaign. We are asking a lot of the front line, and very grateful to everybody in healthcare. And so another area of investment that has really broadened our reach is working directly with workplace mental health. $3 million was invested into what we call the Workplace Mental Health Hub. Jonny Morris from Canadian Mental Health Association BC mentioned this, a really good partnership that we've been working on together. It was part of the emergency pandemic response and also part of economic recovery. And it's a tool that we need right now as well. So it's not just specific to the pandemic. We're also making it easier for British Columbians broadly to get help for mental health. We have an expanded 49 community counseling programs where people either get free mental health counseling or else low cost. That's in every region of the province. And virtual mental health online supports continue to be available on gov.bc.ca/mental health supports. But I want to flag, I mean, again, the virtual rollout has been a really important piece of this, which is why it's also so important for our government to have committed to connectivity across the province by 2026, a very fast and ambitious connectivity program, because this is one of the ways we're going to be able to connect people with healthcare, substance use care, and mental health care. A particular one, this isn't just about workplace, but it really can benefit a lot of families, is our expansion from Foundry centers, which were designed for youth up to age 24, as a walk-in physical center. During the pandemic, we moved that to a virtual platform, and there's now an app called Foundry BC that young people can download. It was designed for and by young people. Same day appointments, counseling online, group counseling, lots of group chats, video calls. It's really been such a kind of a breakthrough tool, and one that is available to caretakers for young people as well, their caregivers, I mean. So anybody that's connected to a family, worth also checking out the Foundry BC app, in addition to the Workplace Mental Health Hub.
What a wealth of tools and products. Thank you. We'll include all of them in our links to all of you. So thank you for sharing them. And really nice to know there's a Workplace Mental Health Hub as well, knowing that as many avenues as possible to help support connections to employers to get access to the right tools and products is extremely valuable. So thank you. Ashley, over to you. Although we're not seeing the same numbers in manufacturing across BC in terms of mental health claims, we see they've increased by more than 60% over the past 5 years. Overall, can you talk about how workplace mental health claims are evaluated and assessed today, and how does WorkSafe BC assess liability, in a mental health claim?
Sure. So in terms of the process of filing a claim, it isn't all that different whether it's a psychological injury or a physical injury claim. I think that I can also, if it would be helpful, we do have a lot of really good, clear information on our website. So www.worksafebc.com. And then there's a link right on there about how to file a claim. And there's a lot of really good detailed step-by-step information in there. But certainly, yes, we have seen a significant increase in the number of psychological injury claims. I think that we'll be up at around between 23 and 25% increase this year in psychological injury claims, which is, it's huge, it's significant. The cost of people's lives is drastic, and COVID has played a part in that too, I do believe. It has been a tough year. So there's the step-by-step process, as I've said, is online. In terms of, there's kind of, how much detail do you want me to give in terms of what a psychological injury is? Maybe I'll break it down in kind of 3 main areas. So sometimes people will have a psychological injury that develops as a compensable consequence of a physical injury. So someone injures their back, they're off work, they're detached from doing the hobbies and things they enjoy, and then they'll develop maybe major depressive disorder as a compensable consequence of that physical injury. So that's kind of one type of psychological claim that we manage. The other two are either a traumatic event or a significant stressor or a series of cumulative stressors. So those are kind of the 3 main categories. So the test of whether a claim is allowed is sort of, it's quite a process. A component of it involves getting a diagnosis by a psychologist or a psychiatrist. And so we do try to make this as straightforward and clear as we possibly can when someone calls in. So they call in to teleclaim, which is 1-888-WORKERS, and they will speak to someone in teleclaim who will help them understand what the process is like, how we would evaluate whether something would kind of meet that threshold to be accepted for a claim. And then once you are in, then the next step would be, what do we provide to support you? So sometimes that might be wage loss benefits, and other times it would be healthcare benefits. And so healthcare benefits could be everything from online CBT to treatment with a psychologist who specializes in trauma to an inpatient treatment program. So it would just really depend on the needs of that individual, but that would be managed on a case-by-case basis and how we would support each person in their recovery and return to work.
Thank you, Ashley. And we can provide some links if people want more information specifically on this.
Absolutely. Yeah,
But
it can feel like a bit of an overwhelming process for workers and employers, but our website lays it out pretty clearly step by step. So I think that's pretty helpful.
Thank you. Thank you, Ashley. Moving over to you, Jonny. According to the Mental Health Commission of Canada stats, every year mental health concerns and illnesses account for 20% of sick leaves and 30% of disability claims costing Canadian businesses 50 billion a year in lost productivity. While the financial cost is substantial, it's also an indicator of the scale of the problem that we have. Can you give us any perspective on the cost to BC employers and what that means for business in our province?
It's a big and an important question. And over the years, there have been significant efforts here in BC. There used to be an economic roundtable that was chaired by actually a financial leader that really tried to quantify the financial implications of not attending to workplace mental health to employers. I appreciate your question because I think you're attempting that the cost goes far beyond the bottom line. And actually our bottom line conference is happening in a couple of weeks where we've kind of tried to expand upon the cost to really take a look at the social, the human, the productivity costs that come with not attending or failing to attend to arguably what is a moral imperative to take action around workplace mental health. And we have a duty as employers to do that. And it's not rocket science. We can find a way forward to do this together. So I think for employers, there's the cost for the employees, or an employee themselves struggling with distress. Maybe they are living with a mental health or a substance use problem or a range of problems. It can be an incredibly challenging time for that employee, particularly if they don't feel able to raise their hand and say to their boss, I need help. And so there is that cost. And so, of course, you have employees who leave or employees who are present, that notion of presenteeism, but are not able to do their jobs because they are experiencing a health condition. They are experiencing distress related to their symptoms. I think I've learned this from folks in the manufacturing space and elsewhere. Our ability to have good judgment, our ability to feel connected to our work, to feel balanced, to not be in distress, of course, has a relationship to preventing errors, mistakes, injuries in the workplace. And so someone who's experiencing distress might not be as able. We can all think about times we've been in distress. Our rate of making an error goes up, or we might not be applying the same level of judgment or discernment in a moment. And so, for employers, especially in sectors where there's a real emphasis on injury prevention, we want folks to be experiencing well-being and mental health and balance and care and not feeling overly stressed, burnt out, or fatigued. We all want that. And so that's another form of cost that I think employers face. There is a tremendous opportunity on the flip side of your conversation of the corporate social responsibility or the reputational piece that can come to be known if you're an employer that is known to value mental health and well-being in the workplace. We see this in post-secondary, people choosing universities and colleges because there's a commitment to mental health and well-being. And I think when we look at employers, and I think all of us are recognizing there's huge shift in the market right now for employees. Some folks are seeing attrition, some folks are seeing movement. I think employees are really looking for workplaces that place a high value on the care that can be provided in the workplace, resources, but also the context, the culture, the environment, that should be deeply conducive to supporting mental health and well-being. Because after all, and I think you've said this, or I've heard others say this, we don't just show up with our bodies at work. We bring our whole selves to work. And that includes our mental health, which we all have a relationship to.
No, an excellent point. Absolutely. And it's harder to see, you can see a broken arm. But unless you're really looking and asking those questions, and building the programs around that, it's not straightforward. Minister Malcolmson, moving forward on looking at the opioid crisis, as we deal with this challenge here around the province, many BC workers are also substance users, or struggle to cope with a family member's addiction. Are there provincial programs, and you mentioned these at the beginning, or resources employers may find helpful in strengthening their health and safety programs in this area or supporting their teams in this area?
And Lisa, I just so appreciate the Manufacturer Safety Alliance kind of airing this conversation, because I've been really inspired to hear from the industry leaders who are really taking responsibility and see workplace mental health and tackling the toxic drug crisis as a responsibility of theirs. And we need all hands on deck on this. So here's a program that I've been particularly inspired by. The Vancouver Island Construction Association partnered last year with the Health Authority here on Vancouver Island to do a really innovative kind of in-reach into their own job sites across the island. And it's particularly important because, as the coroner has reported, the people falling to the toxic drug crisis are largely men. 35% of those who died were employed at the time of their death, and the great majority of them were employed in the trades, transport, or as equipment operators. Most number of people that are dying from this accidental overdose are men ages 34 to 59. And those, notwithstanding new supports that we're building up, opening more overdose prevention sites, supporting harm reduction, prescribed safe supply, decriminalization, all the things that we're doing, those individuals may not avail themselves of any of those programs. And often, tragically, they die alone, using drugs alone, and their family and friends had no idea that they had challenges with addiction. So there just wasn't an in to have that conversation about whether they were doing something life-threatening. So this was the beautiful program that was built by VICA, the Vancouver Island Construction Association. It's called the Tailgate Toolkit. We just about a month and a half ago stood together, and our government is funding the expansion of this now with the BC Construction Association, employers across the entire province, to mirror what VICA did here on Vancouver Island. So this is a program that comes to the job site. It teaches people about the risks of using drugs alone. It teaches them about pain management options, about drug poisoning prevention, access to treatment, and particularly it encourages the conversations like we're having today about reducing stigma associated with substance use and really encouraging people to reach out for help. So the Tailgate Toolkit project, you can see it, the tailgatetoolkit.ca online. And any employer, I think in any sector, if you're curious about supports and resources that might be available, recommend that you look at it. It's a fantastic website. And if you are there and you're within the association, I guess you can register for supervisor training sessions. You can find region-specific resource guides that would have particular links to treatment and recovery options. But there are on-site and virtual talks, basically kind of bringing this conversation into the morning safety talks on a job site, supervisory training, so that the leaders learn to recognize and support people with substance use and mental health challenges in the context of the workplace. There's an industry support group called Hammer Time, where frontline workers with lived experience of substance use and working in the construction industry facilitate these group conversations. There's a fellow who was with us at our announcement that I was particularly inspired by, Trevor Botkin in Victoria, who works with a group called Hero Work. He talked very compellingly about his 25 years of substance use, where he hid it from his coworkers and his family. He was working in construction, and he now describes the gift of his recovery as him being in a place to contribute to the Tailgate Toolkit project to help others find the support and the direction and the courage that they need, as he said, to step out of the darkness and find peace. And that's a place that he is, and he's able to harness that into this really inspiring project. There are resource guides, region-specific information for people working in trades available to them within their region, and especially resources that are beyond their benefit packages. Pain is so often at the root of this, and so this is an example of a project where we're really working together to help support people at a really challenging time.
What a powerful example and what an impactful outcome. Thank you, Minister, for sharing. And the information, again, will be circulated in the, I believe it's in the chat, but it'll also be included in the package distributed to all of you. And we need to know more of that. I mean, that partnership and showing and seeing the success of that is just extraordinary. So thank you once again for sharing that, Minister. And talking about stigma, Jonny, another concerning statistic is that 60% of Canadians with a mental health concern or illness won't seek help for fear of being stigmatized. You know, what has been your experience at CMHA with mental health stigma or harassment in the workplace? Are there specific areas you'd like to recommend employers consider and address first?
Well, I mean, I think in honoring your question, I would start with my own personal experience. I mean, I've been a CEO for 3 years now at CMHA, and it's only within this past 3 years that I've been open about my own lived experience of depression and almost not making it through university in my early 20s because I was so depressed and not able to function due to my illness at the time. And I was at a conference about workplace mental health where I was listening to people, much like Minister Malcolmson was describing, who are open about their experience of living with a mental health or a substance use problem. And it dawned on me that here we'd created a space for people to share their story, and yet I hadn't felt safe or able to share my own story. And it's because now I have a platform, I have the privilege and the influence that comes with being at the helm of an organization where I felt more comfortable to be open about my own lived experience of depression over the years. And I think that says something about you know, the power of stigma and the fear of what might happen if one tells their story. And I think there are countless Canadians, I think there are countless people probably on this call who would second guess the decision to raise their hand to say to their employer, I'm struggling, I'm living with a substance use problem, or I'm living with a mental illness, because there's a very real fear of, will I get passed over for a promotion? Will there be a question, you know, about whether I can do my job or not? Will I be treated differently by my colleagues or my employer if this gets out? And that's alive and well. We have come so far. I mean, that's the heart of the Canadian Mental Health Association. We were stood up over 100 years ago to address stigma, both structural stigma and also the individual stigma that people experience in community. And we have come so far. Would this conversation have happened 20 years ago? I don't know. I certainly didn't feel safe 4 years ago sharing my own experience. So where can employers go? Well, I think WorkSafe and other spaces is key, because there are legislated, statutory, regulatory expectations around what employers need to do around a duty to inquire. So if you are concerned or you have reason to believe a staff member is in distress, there's grounds and there's ways where we have to explore and, if necessary, find ways to accommodate. So always good to look at the advice and proven guidance within the context of WorkSafe or within your own legal counsel or your own HR policies. That's so important for employees to understand that there is an expectation to accommodate where needed when it comes to disclosures around mental health or mental ill health in the workplace. And I think finding ways to ensure you have policy documents that articulate your expectations and the ways that you'll operate as an employer around how you support people with mental illness or substance use in the workplace, whether that be your policies around substance use or your policies around referring people to treatment and support, are all very explicit and visible ways that signal to your employees that you care, you've done your homework, and you're willing to act in a reasonable and responsive way, when someone does raise their hand. There's nothing worse than someone who's plucked up the courage to say, hey, I need some time because I'm dealing with depression, to feel dismissed or to feel ignored or to have that mishandled, because that person will never reach out again. So it's really important for you to understand what you're accountable. And again, there are great resources with us, with your association with WorkSafe, where we can walk along and help people negotiate what they need to do when it comes to helping employees feel safe to reach out for care.
Thank you, Jonny, for your leadership and sharing your story. I mean, it is important that we all work towards creating that environment where we can feel comfortable sharing our story at all levels within the organization. And just, to your story, 4 years ago, you didn't feel comfortable, but now you do, is an indication that we are moving in the right direction. And all of us, with our resources, tools, and mechanism to help everybody move forward, I think is really very impactful and a place that we all are building towards. So thank you. Ashley, looking at prevention, most employers are familiar with traditional hazard assessment and controls to reduce risks of physical injuries, as we've talked about. When it comes to mental health, the boundaries between what happens at work and what people bring with them from home are fuzzier. So we've just talked about stigma. How do we now bring this into a more normality? What responsibilities does the employer have for preventing psychological injuries at work? And where do they begin?
Right, that's an excellent question. And, because I don't work on the prevention side, I work on the claim side. What I will say is many of the claims, I would almost say most of the claims that I see could be prevented. And there are so many things that employers could do. Now, yes, the Act talks about health and safety. It does not necessarily specify psychological health and safety, but it certainly can be interpreted as inclusive in that in many areas. But there's a significant cost, an economic cost, and a human cost to not creating a psychologically healthy and safe workplace. And I will see two claims from a similar industry where, let's say, someone was treated really disrespectfully, horribly by a customer. And one situation, a leader is super supportive. They're just as upset about it as that worker is. They say, what do you need? How can I be there for you? And that person maybe misses 2 days of work and gets some short-term counseling and they're back to work. And they're not disabled by it and it doesn't impair them in a significant way in life. And then you see someone else where the employer doesn't care or doesn't reach out or, becomes so disconnected that there is this big barrier. And there's so much confusion around psychological injury for workers out there, especially with confidentiality. And medical is medical, whether someone has a physical condition or a psychological condition, it doesn't matter. Medical information is confidential. But it's no different because someone is struggling with PTSD versus a broken ankle in terms of what's confidential. Their medical is always confidential, but it doesn't mean that you can't reach out to them. It doesn't mean that they can't still be involved in work in a way that's comfortable for them. It doesn't mean that there shouldn't be modified duties for most people with most mental health conditions. So this is a real challenge I see, is so many of the claims could be prevented by having a more psychologically healthy and safe workplace. Sometimes it's hard to be within the control of the employer because people are exposed to the public as well. But I still think even in those cases where horrific things happen, I see the support from the leader, the support from colleagues. It makes an absolute world of difference in terms of how much that incident impacts someone in terms of their ability to function and their ability to work and their ability to carry on with a meaningful life. So I couldn't say enough how important it is to have a psychologically healthy and safe workplace. And when we, Jonny talked a fair bit about the financial impact. And I also realized, Lisa, that you asked me a question about what is the responsibility of an employer or when is an employer liable? And so just to kind of weave that in as well to this, it's a no-fault system. So it isn't that an employer per se is liable. That's why we have, insurance and we provide those benefits to workers, to support employers and workers. But it does end up costing employers money if they are allowing things to happen to workers that are more likely to cause a psychological injury. And so either they pay for it in an increased assessment cost through WorkSafe BC because they have a number of psychological injuries, or they're paying for it in their short-term disability, long-term disability, absenteeism, presenteeism, retention. Employers are paying for the cost of this one way or another. And yeah, I couldn't say enough how many of the psychological injuries that we see could be prevented by employers.
Thanks, Ashley. In a world where labor is so important to, especially in a shortage situation in the manufacturing sector, not only is it our responsibility, but ensuring that we create a culture of prevention is really the only way forward for everybody.
Absolutely. I couldn't agree more.
Minister, in response to the continuing impact of the pandemic, can you share how the ministry plans to continue providing an expanded support for workplace mental health, and talk about some of the programs currently available to BC businesses or workers?
Just to follow on the conversation from Dr. Spetch, it's a lot of us didn't grow up with these tools and didn't learn it in our on-the-job training, but to have employers step up and model both the vulnerability about being able to say that they're feeling grief or anxiety, it just can't overestimate the power of that in the workplace. And also for employers and managers to learn some just very basic skills about how to have those difficult conversations and how to make a workplace safe for that. I think especially through the pandemic, we've really recognized, when people are working more in isolation and not within their ordinary structure of their day and the sort of comfort and camaraderie of the workplace, that there have been some people that have had particularly challenging time. And so that's very much what the Workplace Mental Health Hub that both Jonny Morrison and me and I have been speaking about, this toolkit basically that we put together to be able to help employers and managers navigate those and initiate those kind of challenging conversations. And once you kind of get in the habit of it, or have a few tools to bring to the conversation, just takes a lot of the tension out of it. And again, we can normalize these. It's a increasingly important part of workplace safety is that mental health safety. So that Workplace Mental Health Hub that we launched last year, we will continue to support that, and we really see the great importance of workplaces and employers fostering psychological safety. What we also developed in relation to the pandemic for the long-term care workers and other healthcare workers that were particularly under pressure. Another site designed by and for healthcare workers, those on the front line, called Care for Caregivers program. It's also online, and Care to Speak, also a direct connection. So this isn't about this sector, but it is another tool. And so if you do have family and friends in those caring sectors, please let them know about those tools as well. The workmentalhealthbc.ca link has got information, webinars, workshops that employers can tap into, and it's all free. We really want to support those important conversations. And then again, this isn't about manufacturing specifically, but some of the particularly hard hit sectors through the pandemic have been have been front of mind for our ministry as we've been designing these tools. The tourism sector, we heard from some of our partners. Go2HR was a kind of a validator or a partner in our announcement to expand the Workplace Mental Health Hub to some new sectors, and talked in particularly powerful way about the tourism workforce and how they've been very hard hit and needed particular support. And the coming together around this Workplace Mental Health Hub recreated in some cases the conversations that might have happened in the workplace, just to let people know that they've got extra support beyond just what they can see in their immediate circle at a particularly tough time. And we are going to need those resources for some time to come. We're not out of the woods on this, and I just have, despite it being such a difficult time, I have a lot of confidence that we're all going to come out of this pandemic experience with more tools to navigate whatever comes ahead.
Thank you, Minister, and thank you for the investment of these valuable tools and products. We now need to build those connection points into all of the employers and get used to using them frequently and making it a way of life. And that is where the work begins throughout all of the, certainly from my perspective, working with the manufacturing sector throughout the industry in that realm, from micro to the largest employers. Lots of work in that, but really excited that there are tools out there to support our industry. Jonny, now looking at another key support in terms of employee assistance programs with mental health claims on the rise, what should employers be looking for? Because they're really important programs to be able to introduce to individuals that need specific areas of help and support. And what other resources are available to employers and employees who don't have access to an EAP program?
Just before I answer that great question, just to extend Minister's comments, through our targeted work with other sectors, we've been able to reach hundreds, if not thousands, of people with those educational resources, and particularly to Dr. Spetch's comments earlier of equipping managers to speak with the investment we've received. We've been able to launch this pioneering group of learning coaches who will walk alongside employers who are trying to figure out how to implement these things. And so I think out of this work and given the strength of our relationship, Lisa, between our associations, our hope is there's ways that we can leverage the curriculum that we've built on behalf of the province and this model of personnel, people-powered support for employers going forward, and strengthen the partnership with WorkSafe and your HSA alongside our other partners at Go2HR. And so there's been a lot that's come through there, and I got the stats just a few days ago just to see the volume of people, almost 700 people who've run through the training curriculum. It's been great to see and very encouraging to echo Minister Malcolmson's comments there. There are resources that are available in addition to EAPs, and sometimes it's a struggle for small companies and firms to necessarily identify or find resources that don't exist within an extended health plan. So employers likely have an extended health plan. Sometimes that can be limited, $500 a year for counseling support. It's about 1.5, 2 visits maybe. Sometimes there's an EAP program, which of course are very important because it offers a different kind of support than an extended health. But it's really important to highlight that there's actually resources, and I really appreciated Minister Malcolmson's comments there around kind of the fabric of care or resources that might be beyond view. Bounce Back is a great example, funded by the Ministry of Mental Health and Addictions under Pathway to Hope. It's been around since 2008, and it's people-powered depression and anxiety care, completely free. And we serve almost 8,000 people a year who come through that program experiencing low mood, stress, or anxiety. You're paired up with a person again. You're paired up with a person who can walk you through a proven model that's really been shown to help people with their thoughts, their feelings, and their actions and their behaviors, particularly around low mood, stress, and anxiety. So Bounce Back. Currently, we've expanded that nationally, and we continue to be so grateful for the ongoing investment. And there's a question about primary care in the chat. It's a great example of a program that absorbs capacity from primary care. We free up doctors to deal with more severe and persistent mental illness, whilst we provide a proven care model with coaches that's been shown for 70% of people who at least fill out our survey, 70% of people who come in with quite clinical symptoms as they leave the program are doing much better. That there's a real improvement. The other thing I just echo from Minister's comments is community counseling. So often there's a barrier to cost, and we at CMHA have been so encouraged to see community counseling agencies receive such an infusion of supports. These are your neighborhood houses. These are your family services centers. There's 49 of these agencies that are funded through the Community Action Initiative who can now provide free or low-cost counseling. And it's from my perspective, the biggest game changer that we've seen in trying to increase access to psychotherapy and counseling. And we get to see the data that comes through because we're a partner. Thousands of people accessing counseling and a chunk of people who've never been able to see a counselor before who've now seen a counselor. And so employers on this call, and we can pop this link in, can look up local community counseling agencies. They're actually listed on the virtual supports page that was posted earlier. Again, somewhere that people can point to their employees to say, help is available, including Foundry, a huge resource for young people in this province. And if folks are looking for support locally, you can check out your local CMHA branch as well, who provide really, really cool supports and services locally and regionally in community.
Thank you, Jonny. And we will package all of this in the right resource toolbox when we circulate it to all of you. So thank you for sharing that. And to all our panelists today. Connections like these are critical in working together to support our industry. And today has been a step forward towards aligning our strategies and resources together to support employers. There are some questions coming through, so I'd like to get to some of them as we approach the hour. This is to you, Ashley. Looking at, sorry, I just moved here. Given that we are looking at the key considerations of employers returning to work with a potential mental health related claim, what do you see as the key considerations in preparing employees for that return and employers for being prepared for that?
Sure, that's a great question. And we do a lot of that work in supporting both the employer and the worker with how that return to work goes. But I think that the biggest and easiest thing, and something that you'll see kind of converge across all of the resources, is just genuine care and compassion and approach, right? I think that sometimes there's some hesitancy and some nervousness around a psychological injury, and whether it's a WorkSafe claim, the injury was caused in the course of employment, or if it was caused by something completely unrelated. It's not all that different really in terms of supporting the return to work, but to treat it much like you do a physical injury claim. And so if somebody has bronchitis and they're out for a month and you buy them flowers and then someone else is off for, what they call a stress leave, which isn't really why someone is off, right? It's because they have a diagnosed condition and they're off work because of that medical reason. It should be treated the same. And so, I think sometimes that's a helpful way for employers to look at it, is to think, if this person had broken their leg in a car accident, how would I treat them? And to do the same thing, right? And of course, respecting their comfort and that all medical is confidential. And I think also to try as much as you can, as much as that person is comfortable, to stay connected while they are off work, right? Because the longer someone is off, the harder it is to return. And a big piece of that is the connection, just, checking in. Throughout my career, I've had employees off work for various reasons. And, it's not talking about work, it's just to call them. I've had coffee and had dessert with people who've been, of course, pre-pandemic when we could see our colleagues face to face. But, do you want to meet and have a dessert and see how you're doing? What have you been spending your time doing? How are you feeling? Is there anything that you're wondering about? What's new? Who's retiring? Just, it's just that human connection and care and compassion. I think that's where we really need to go to reduce the stigma, is to stop seeing it as this, this big thing that's so different from some other kind of injury.
Thank you, Ashley. And absolutely, creating that culture of care. And that's really, those connections that you would with, whether it's physical injury or a psychological one, really important for all employers to build. Jonny, over to you. Given your personal experience, what do you think would help most in supporting employees to feel safe to disclose their own mental health struggles?
I think the piece that's been most helpful to me, well, I remember the first time I reached out for help was having someone who sat with me to listen, to understand. And it lines up with the wonderful comments that Dr. Spetch just made around that kind of reach out and care. Like, we can all show up as caring humans and to make the right amount of space without kind of reaching in to give advice or problem solve or rescue, but simply to hold space, to listen, to understand, not listen to solve, but listen to understand, I think can go a long way for employees feeling this is a safe space for me to share that I might need some help, or I might need some support from my employer going forward. And I think if we think about our workplaces, we can think about people who stand out as great listeners. I've already have a strong sense of Ashley as a listener here. I'm often struck by Minister's ability to listen and recall those pieces, and you too, Lisa. Like there's a good listening group here, and I think listening is underrated as an avenue, as an opportunity. Sometimes as employers, we can worry that we've got a problem to solve, or there's a crisis that we have to fix, but to even get to solutions, we have to really understand what's happening. And I think listening is the key step to get there.
Thank you, Jonny. I mean, I think it's easy to say, but maybe harder to practice consistently as we live in our busy worlds and thinking ahead, especially as leaders. So thank you for reminding us all of that important skill that we need to practice and get better at, because it's really important we create workplaces and communities of care that work to help support this important area. Mental health is something that we all need to work harder at supporting a path forward to build those places within our workplaces and communities that will absolutely make us stronger together. So looking at where we are approaching upon the hour, I'm going to have to stop here and thank you once again to our privileged group of guests that have been able to support us here today on this panel. We are very, very privileged to have you here, and thank you for taking the time to participate in this important conversation. It really is the beginning of many conversations. It'll be the first webinar of our series this year, but many more as we work to help support more conversations like this. So with that, I do want to share, we have an industry panel on workplace mental health on April 26th. More resources available on our website tomorrow, and visit our media library anytime for on-demand content, news and resources, and event information. Once again, if we didn't get to your question, we will absolutely get to your question via email. So thank you for your questions and for joining us today. Please check our inbox for a survey link to share your feedback and suggestions to help us improve on future webinars. And we'll email you tomorrow with the link to the recorded webinar slides and all of the resources. Thank you all. Have a wonderful evening. Take care.